Hello and welcome to all of our Gold viewers who are here with us today. I'm Kristen Schwartz, licensed midwife and one of the MCs here at Gold. And we are very busy here at Gold. We're getting ready for our Gold Labor and Delivery Symposium. And with me here is Amanda Kelloway, and she's one of our speakers here at the symposium. Welcome, Amanda.
Hi, thanks for having me.
It's so wonderful to have you here. You have such a wonderful topic, and the topic is titled Birth at a Crossroad, Imagining Care Through the Lens of Practice. I love that topic so much. And before we jump into this, first of all, I want to hear a little bit about your background. You are in nursing, right? So talk to me a bit about that.
Yeah, so I've been a perinatal nurse for over 20 years. I have been a bedside nurse. I worked in a couple provinces in Canada, where I'm from. And then I did some travel nursing in the States as well. And I live in Burnaby, British Columbia. And I have been here for, I don't know, it's too many years now to count. So worked as a bedside nurse. I was a clinical nurse educator. And then I've also spent some time getting my LC and my childbirth education certification. So I kind of describe myself as a bit of a super geek about birth and breastfeeding.
And physiological birth is, of course, that's your big passion, right? Like, I mean, you've been teaching, you've been, obviously at the bedside so much, and this is a topic that is really, really very near and dear to your heart. And let's talk about a little bit about the topic here: birth at a crossroad, reimagining care through the lens of practice. So, what inspired you to take that, approach, that concept, lens of practice? Talk to me a little bit about that.
Yeah, I actually wrote the original manuscript for my master's. I was focusing on um, learning how people thought. I thought if I can figure out how people learn and how they think, and how I was really curious how critical thinking was developed. And so I wrote many papers around critical thinking, how it's developed, how we foster it or don't in nursing education. And then I started just diving in around developing critical thinking in perinatal nursing, which in fact, there isn't tons written about it. Lots of people in the psychology world have talked about critical thinking. There's lots in terms of the medical world, fewer people applying it in obstetrics. So I was really curious there. And then, so that was one piece. And then my other piece was just my own personal transformation as an RN. I think I started at the bedside. I didn't have any theory education. I got like 12 shifts of orientation, and here you go, you're a perinatal. And I worked in this high-risk labor and delivery unit, and, you know, I just did what the charge nurse told me to do because they were smarter than me. And it really took me a long time to develop some of that critical thinking. And I was very interventionalist based. I worked on a high-risk labor and delivery unit, and like I said, I just kind of did things that people told me to do as I started out. And of course, I learned as I went. But then I started in just getting some more personal education around childbirth education, and it opened my whole window of thinking in my brain to the hormonal physiology of labor, and it literally blew my mind. And the more I learned, the more I started looking at, like, well, how do we utilize that in practice? How do we implement it into practice? And what are some things aligning with this physiology? And how do we promote it? And I started very slowly in my own practice, kind of bringing in little things, and I could see over the next year how just my care changed. The way that my clients' births unfolded was different than they used to be. And there was less cesarean births in my experience in the patients that I worked with. And I got really curious about that, and just started delving more and more in that. So yeah, this is really a combination of why is it just information, or is it the way we think? And because I've been teaching for the last 10 years and been in and out of hospitals, and very lots of different hospitals, and myself have worked in many different hospitals in my 20 years, I've seen that um very much how care is provided is individual, how we think and how we do, but then also how the unit culture surrounds us as well. So it's very much influenced by ideology. So um, critical thinking and then how we think, kind of putting it together, became something I got really interested in.
Absolutely fascinating. And you mentioned you coming from a high risk unit, lots of interventions. And it's easy to see once the intervention starts, it's almost like here we go, and things start developing, right? Like it is very easy to go down the route, okay, from one intervention to the next, and then justifying it in the way like, well, we wanted physiologic birth, but this is really no longer indicated. It is really also about taking a step back and really reevaluating, but that cannot always be easy, right? Like we be in a very high pressure, environment as well. We're dealing with other stuff, the families themselves. Maybe mom has a certain way she wants her birth to be, but the family is not always supportive. How do we integrate all that?
Yeah, so like I talk in my talk, one of the very first strategies, it actually just starts with us. Like, yeah, you have to start with you. Where are you? You have to know that this lens of practice exists. You have to know that there's a spectrum. I think right there, many people don't even think about that. Don't even think that they're on the spectrum to begin with. And many are surprised when they really think about it. They're like, oh yeah, we're totally apart, like physiologic birth. Yeah. And then you really kind of delve into it. And they're really much closer to the risky side, the risky lens, than maybe they even knew. So I think first step is you have to be aware of the fact that these lenses exist, and second, that once you have that awareness, you actually do have a choice. You can
Right.
pause your brain. If we don't have that awareness, your brain will automatically go to that fast thinking, and it will go to what it used to do, and it will really easily be swept up in what other people say and doing what other people think instead of sort of taking your own opinion or your own knowledge and applying it. And that's the whole point. As soon as we're aware that we can make that choice to put on that lens and then think, hmm, does this make sense? Does this
Yeah.
intervention make sense? Does it align with what this person and this family wanted for their birth? Have I had that conversation with them? And then also, you talked about that snowball effect. When we're looking at our decisions through that lens of pausing, um, every decision is then looked at through that lens. So you're going to be quite curious about each of those interventions, and there will be an opportunity to maybe the first couple, yeah, they're totally indicated. But is this third one indicated? Oh, maybe not. Or is this fourth one indicated? Oh, maybe not. Now we're kind of in convenience territory, right?
Mm.
And sometimes they are necessary, but sometimes maybe they're not. And so just that simple act of being aware, putting on that lens makes you pause, it makes your brain think a different way. And all of a sudden, we have to force ourselves to think critically rather than
Right.
just rote.
Yeah. Hmm. And it's not an all or nothing approach either, right? Like this is what you just described, maybe there are certain interventions that are necessary. However, maybe it's the third one really necessary, So really going down that road, and also for the family who maybe, who really they wanted a physiological birth, maybe it didn't happen the way they hoped, for whatever reason, and also communicating with them, there's still, we can still do stuff here, this is not all or nothing. There even it doesn't have to be always the big issues. Wait, talk to me about like some small, smaller scale things we can do in a situation like that.
Yeah, I think one thing that really jumped out to me when I was researching this content was the rise in traumatic birth.
Mm.
And what we know is that the numbers are rising, and that it's actually not predominantly having a necessarily interventional birth. So having a cesarean birth or even having like a significant tear. That's not necessarily what dictates a traumatic birth. The research actually tells us that the most integral components for a traumatic birth are actually a sense of loss of control, a sense of
Mhm.
not having their birth wishes heard, and feeling like things were done to them rather than having consent, and then really just that sense of how they were made to feel throughout their labor. So I think one of the things is really just starting out with identifying that that the base of things, because we're healthcare providers, we hold power. We right off the bat, we have a power differential, and we can choose to level that power differential, or we can choose to continue to be up here. And we inherently are up there because of our credentials, because of our knowledge, and they actually put us up there, right? And then one article that I read that just really blew my mind is that, you know, originally birth happened in people's homes. And when birth
Right.
was unfolding, the people that came were invited guests into that
Yeah.
home and into that birth. And then when birth moved into the hospital, now who's the invited guest? It's actually the birthing person, this woman. And so if we can approach every labor like that, who's the invited guest here? Right? Yes, they're in our home in the hospital, but do they have to be this like stranger and be the invited guest? This is their
Right.
birth. This is their room. So are we talking to them in that vein? Are we including them in the conversations? Are we talking about the tracings at the bedside so that when they have questions, they can ask them right away? And
Right.
then when things are starting to go a little sideways, it's not a surprise because those 6 times that the team came in to look at the tracing, they were involved in that conversation. They could see it unfolding and could see things changing and go, "Oh, I'm seeing that this is just the way my birth is going to unfold." And they see the team, they're supporting me and they're answering my
Mhm.
questions. And I get it. This baby just wants to come out by cesarean. I'm okay with that. I- And of course, there's going to be some grieving if there was a different
Right.
intention there. And we have to be open to acknowledge that our everyday
Yes.
world is not their everyday world, right? Again, who's that invited guest? What information do they have that they did they don't already know? And then, really being clear about that power dynamic. So really simply, I think if
Mm.
we just basically knew that right off the bat we have a power differential and we intentionally every conversation, every act, every smile thing just was there to level that power dynamic. I think that alone can change things.
Fantastic. I love that. Who is the invited guest? I absolutely love that. And taking a step back and really thinking things through without just jumping into, the typical thing. We always have done it like that, or, into action, action, action. This is, what we need to do, or ticking off the boxes, right? Like, so really, really being there also mindfully and being there with the family and taking, like, looking, okay, whose birth is it, right? It's not ours.
Yes.
So really going into that. So before I let you go, what are you hoping our viewers will really take away from this presentation?
Ooh, that's a really good question. I think for me, I really want people to know that they have power. We have power in multiple ways. We just inherently have power, which puts us up in this sort of place up here. And so it's our job, it's our responsibility to level that ground. But second, we can leverage our power in a very positive way if we have the correct knowledge and the skill to kind of push, not push, but like to use our influence in a positive way. I think that's sort of thing that really just jumps out to me is that we are we're so integral. That person's going to remember their birth forever. And we have the power to kind of shape a birth and create a trajectory that is powerful and empowering and strength building and confidence building so that when they move into their parenting, they feel like ready. I've done this really hard thing and I can do this parenting thing, no problem. That's how they're supposed to enter. And we can have a
Right.
part in curating that experience. Or we can also have a part in curating an experience that was filled with trauma, of scariness, of stress, of doubt, of decreased self worth, of minimalism, where they feel disempowered and feel incapable of making decisions. And so you think about how that actually sets the trajectory into parenting, right? They're going to doubt everything. They're going to feel like they can't actually make choices, that they aren't even worthy or capable of making those choices.
Yeah.
And by the way that this birth unfolds, either in a really positive way or a negative way, that shapes that trajectory. So we
Yeah.
have great power to influence the trajectory because we're in the room with them and we are the ones that are spending the most time with them.
Right. Absolutely. Oh, I love everything you said about that. Let's make it in a way, let's facilitate that birth, that it's empowering, that they really feel ready for anything afterwards, after that experience, and look, are able to look back to this, experience as, even if maybe it wasn't the birth they hoped for, expected, but as you said, it's not so much that is like, how was everything explained? How were they made felt? How were they feeling? How were they supported? And how were they treated? included in that, and were they really a partner instead of just like a patient. We don't want patients, right? We want we want it's their birth. We want to be there for them, and their center stage, and yeah, absolutely. So thank you so very much for talking to me here today, and we're all looking forward to your presentation here at the Labor and Delivery Symposium for Gold 2025.
Thank you so much for having me.
And thank you so much. And for some information for our viewers now, if you're interested in this presentation and want to learn more and about all the other wonderful presentations that we have for the symposium, including our free and open access keynote presentation that will be live on October 6th, we invite you to go to goldlearning.com for more information. And I hope to see you all at the symposium. Bye bye, everyone.